Hi and welcome to tonight's live, where I'm speaking with the wonderful Dr. Lynn Burmeister, who'll be joining us shortly, about a topic that we share a passion for, and that is the 90 days prior to conceiving, when you have the opportunity to optimize the health of your egg and sperm to improve your chances of a healthy conception, a healthy pregnancy, and a happy, healthy baby. Hi, I can see a few waves there. Lovely of you to join us. If you've got any questions as we go along, feel free to ask them. I know I've had a few DMs before we jumped on, so I will be covering those questions, but if there's any more, definitely let us know. So I will just jump in. And Lynn is just joining us now. Hi, Lynn, how are you?
Good, how are you?
Good, lovely to see you this Sunday night.
Yeah, good to see you.
Now, there's lots of new faces and lots of people joining us, and I've had a few DMs already, so lots of questions.
Yeah, great.
But for those new to our lives, tell us a bit about your journey. I know I can never get sick of hearing about your passion and your qualifications and what you've done for fertility in general. So tell us about your journey.
Well, thank you. So I'm an IVF doctor, but I didn't just start off being an IVF doctor. I studied medicine, which takes 6 years. Then you do an internship. And then I entered into general surgery training for a couple of years. And then I found obstetrics and gynecology. And I really developed a passion for helping women out. And during my obstetrics and gynecology training, I met Professor Carl Wood. And he really took me under his wing, and he was one of the pioneers and founders of IVF. And he took me under his wing, and he actually suggested that IVF would be a great profession for me. So I started learning IVF with Professor Carl Wood at Monash IVF. And then I travelled overseas to New York, and I worked at the Centre for Reproduction and Infertility in New York City at Cornell Hospital. And I spent a couple of years training in IVF there as well. And then I came back and completed my certificate in reproductive endocrinology and infertility, which is a 3-year course and another big exam at the end. So by the time I finished all that, I think it took me probably 15 years to complete all my exams and everything, and then I became an IVF doctor. So and I spent the first part of my career delivering babies. So I used to get the patients pregnant, and then I would deliver their babies as well. And then as I became so busy with the IVF, I had to phase out delivering the babies.
Yeah, and look, your passion for fertility is quite obvious. So your clinic, now you've started your own amazing clinic. So tell us a bit about that before we dive into the questions.
Yeah, so I started Number One Fertility 3 years ago, and it's a bespoke boutique clinic, and we sort of want to just keep it in a way just so that every patient feels very well nurtured. They feel that they're just number one, and that's why I called it Number One Fertility, that every patient feels that we're on top of her case or their case, and that we take every case very seriously and also treat everyone as an individual. So all our treatments are very tailored to the patient rather than protocol driven.
And you do some amazing groundwork with your patients, which I love. And I might start off with one of the questions that got DM'd to me this morning from a couple who are 39 years old, both of them, and they've had one child, but they've been trying for another 6 months and not getting anywhere with a second pregnancy. When is too early to get help?
I don't think it's ever too early. Once you hit your 35th birthday, I think even if you're struggling in the first few months, I think you should seek help. And just to make sure that everything's working properly. We might not treat you for anything, but just make sure you're ovulating, the sperm's okay, that you know when to time everything. So after your 35th birthday, your egg quality declines, and we can't bring that quality back, to a point where your eggs are going to be 25 again. So we can help with all the dietary things that you and I do, Tasha, or mainly you do, but we're not going to make a 35-year-old egg a 25-year-old egg. Yeah. So after 35, your eggs decrease in number and quality. And I think even if you're 39 and you've had a baby easily, you should come and seek help even in the first few months of trying.
I agree. And I think there is a perception that if you go and seek help, you're going to go down IVF, or you're going to get pushed in a direction of getting, I guess, artificial help. And that's not the case. It's about getting, as we've discussed before, sometimes vitamin D levels right. That optimizes your chances of a healthy pregnancy. Just something simple, your vitamin B12, your folate, homocysteine, some of the basic markers. And if you've had a pregnancy before, I think, you know, and you've been breastfeeding, some of those things do get depleted. So it may be something simple.
Yeah, and even thyroid. So sometimes I've just fixed a thyroid disorder, and after having a baby, sometimes that can happen. So even just a simple thyroid disorder and popping on someone on thyroxine can make the difference of whether they're going to get pregnant or not.
We had one recently, a patient we shared, actually, that I've just emailed you about this week, who had been on some heavy immune protocols previously and stuffed around her thyroid, unfortunately, wasn't doing well. Worked with her for the past 6 months, I have to say, and she thought she couldn't fall pregnant naturally. And she emailed the other day, she's pregnant naturally. So it was just a matter, as you said, fixing that thyroid, getting that balance right. Because we now know, yes, we have older eggs and we can't change our age, but we know that it's not just the age of our eggs, it's the environment in which they're developing. It's not just the fact we have 40-year-old eggs, it's the fact that they're developing in a 40-year-old body. So if we can optimize that environment, which we do, we can get a better outcome.
Yeah, and there's a lot of talk about immune therapy and reproduction, but probably the most important thing is when you're considering having a baby is a healthy egg and a healthy sperm. So most of the time when fertility treatments aren't working or you're not getting pregnant yourself, it's because the egg and the sperm health may not be good. It's very unlikely that you've got an immune problem that's rejecting the embryo or rejecting your husband's sperm. That is very unlikely. Otherwise, probably the infertility rate would be much, much higher than it is. It would probably be more around 50%. If we were all rejecting our partner's sperm, then the infertility rate would be much, much higher. So it is about the healthy egg and the healthy sperm. Sure, if we have a beautiful embryo and a gorgeous embryo and you have embryos that you're putting in and they chromosomally are tested and they're normal and you're still rejecting those embryos, then yes, let's look at the immune problems then. But to start being treated for immune problems before you've even done anything else, I would highly suggest that that's not the pathway to follow.
And lots of things you can do to improve your health and improve that immune response as well. And I've just got a question pop up here. Preparing for a transfer, what can we do to prepare for a healthy transfer?
Yeah, exactly. So hopefully we've got the healthy embryo and that's frozen. So the things to do when your doctor needs to choose the correct protocol. So if you're not ovulating, you might need to take some hormones to make you ovulate, or you might need to take an artificial hormone medicated cycle, which is taking Proganova. I usually also give my patients a patch. And then we wait for the lining to thicken up. And ideally, the bare minimum for the lining is around 6 millimeters. So very small. But if we want the lining to be a bit better, we aim for 8. So we like the lining to be around 8 or more, but our minimum is 6. So if the lining's not getting to 6, there are other things we can try and do. With my patients, sometimes I'll inject a little bit of filgrastim, and that has been shown in some patients to help the lining grow. Other things that might help naturally, vitamin E, and Natasha, you would use L-arginine as well.
Yes.
So L-arginine can help to thicken up the lining. So anything that vasodilates the lining. If someone is ovulating naturally, then we can put the embryo in on a natural cycle. I would also recommend, though, when you're doing a natural cycle, that you check the lining, because I know some clinics will just do a blood test and say you're ovulating and then put the embryo in, but I'd also ask for a lining scan, because you can still ovulate naturally but have a thin lining. So always check your lining and aim for either, well, ideally over 8, but 6 would be the bare minimum for a transfer. Then in the month of that transfer, we want we want you to be as relaxed and healthy as possible as well. And if you go into the transfer very stressed and with negative thoughts and it's not going to work, that's not a great month. And if you're feeling very stressed from work or the surroundings that are happening at the moment, then it's better not to do it this month. So that's the other thing, to make sure your mindfulness is healthy as well, and that you're staying in a positive mind frame. The other things to look out for is what you're eating that month. So try and maintain that you're, a very healthy eating pattern as well. And that's where someone like you, Tasha, can help with that as well. And then we get to the transfer day. So I always advise patients not to rush around on that transfer day. Try and take the morning off work. If you can, take the day off work, so that you're not going back to a stressed environment or having to run your normal life on that very important day. I think that day is really, really important. And then coming into the transfer, don't overfill your bladder. Just have your bladder to a point where you're just comfortable. We don't need the bladder super full for transfer. We just need to be comfortable. And usually we can see the uterus through the ultrasound, even if the bladder's not that full. And so once you've had that precious embryo put back in, then home to rest or do something relaxing that day, I would say. Go and watch a funny movie. They have shown that in studies, if you showed patients clowns versus not showing them anything, the patients who were showing clowns and made to laugh after their transfer were actually more likely to get pregnant.
I love that study.
Yeah, I know, it's amazing. And then some patients like to do acupuncture pre and post their transfer. They feel that helps them as well. And then that 2-week wait, which is really hard. And I think during that 2-week wait, it's important to try and keep yourself busy. So you're not constantly thinking about, whether it's going to work or not. Go back to work, keep yourself busy, make sure you're maintaining your exercise program and doing things that you normally do.
Yeah, I think that's probably the hardest part, or one of the hardest parts of IVF, is that 2-week wait. And often have people say to me, I can't get too hopeful because what if it doesn't work out? And I have to say, look, from personal professional experience, it doesn't matter if you can't protect yourself from those feelings. You're going to get hurt either way if it doesn't work out. So throw yourself into the positive, because it does send positive healing neurotransmitters around your body. That is so important to actually create, like that study showed. Laughing at a clown, those lovely happy hormones can have a physiological effect on the healthy baby.
Yeah.
So just had a couple of questions pop up there about BMI and weight and getting that down for egg quality. And yes, I can talk about a few things there, but Lynn, if you want to, I guess, the implications of weight on egg quality.
Yeah, so weight has a lot of implications in our life. So if we are overweight, we're exposing ourselves to a lot of different things like breast cancer, infertility, miscarriage, problems when you're pregnant, so, preterm labor, diabetes, preeclampsia, and so being overweight will reduce your chance of getting pregnant. And studies have shown even a small weight loss of even 5% will improve your chances of getting pregnant, and also reduce your risk of miscarrying. So also, once you are pregnant, it's very difficult to lose the weight once you're pregnant as well. And then the obstetrician finds it hard to look at the baby. And so there's more complications for you. And then you're more likely to end up with a cesarean section as well. So if you can, and you've got time, it's very important to try and lose weight to maximize your chances of achieving a pregnancy.
Yeah, and that can be difficult. So make sure you do get support around that, because if your hormones are working against you, if you are having sugar cravings, insulin resistance, so get some support, because there are supplements we can use to support that blood sugar regulation, support that appetite, give you some framework and structures around healthy eating. Because I've had a few patients come to me seemingly on a healthy diet, doing everything right, so they thought, And there were some key elements that were missing. I had one patient who was eating lots of salads and lots of, but actually she was missing fats from her diet, which is so important. Your omega-3s, your fatty acids for your egg quality is so important, particularly as we age. So there are some simple tweaks. It's also more filling. Her appetite was reduced. She wasn't craving so much. And she was another one who thought she couldn't fall pregnant naturally. And I just saw her for a breastfeeding checkup. So her little one is now 7 months old. So lots you can do with diet and get some support around weight loss. It makes a difference, but it's hard to do on your own.
And I think some people think that they shouldn't exercise when they're trying to get pregnant. That's not true. You should go back to your normal exercise program. Not exercising is not going to help the embryo implant. So you should still exercise even if you're on fertility treatment.
Yeah. And I had a question earlier about vitamin D. We talk about that a lot. And someone said, how much do I take? And well, you're probably the same. Look at blood levels. And I love that you get a workup of everyone. Yeah. It really depends on your unique situation.
And the reference range is around 50 is normal, but we know that your vitamin D should be around 100. Yeah. And there's so much vitamin D deficiency, particularly now that we're all locked at home. And so getting your vitamin D up, I've seen even low levels around 8 on some patients recently. Yeah. And so, you know, just getting them up. So I've even been putting them on 7,000 a day for about 3 weeks to get them up to a normal level, and then just put them on a maintenance dose. And sometimes that's all I've done. Just put the husband and the partner and both partners on vitamin D, and I've just fixed that up, and that's all I've needed to do.
It's so simple. It improves embryo quality, improves chances of an embryo implanting in the uterus. There's so many studies done on vitamin D, which it is such a simple thing to improve. And I had another question of someone who had high homocysteine, which I know you will do in your workup as well, and what that means. Homocysteine is a marker of folate metabolism. So you really want to be making sure you're actually metabolizing your folate, not just seeing folate in a blood test, that it actually is getting into your cells. So can you talk to that, and you request that for your patients?
So homocysteine, when it's elevated, can be linked to miscarriages, and it's a sign that you're not metabolizing your folic acid properly. So everyone should know that if you're trying to have a baby, you should be on a multivitamin with folic acid, or at least just on folic acid, and perhaps a vitamin with some iodine as well in it, unless you've got an overactive thyroid. So get on a good pregnancy vitamin, just as your one is. It's a great supplement. It's got iodine, vitamin D. There it is behind you, Zarcia.
Zarcia there.
So a good pregnancy vitamin is essential. That's number one key. And you need to be on that for at least 3 months before you get pregnant. So everyone should be on a pregnancy vitamin. I'm still quite amazed that some people don't know they should be on a pregnancy vitamin, or at least folic acid, but we still need to keep that message out that, yes, you should be on a pregnancy vitamin before you get pregnant. And if you're metabolizing your folic acid properly, then your homocysteine should be in normal range. If you're not metabolizing your folic acid properly, then you might have an elevation of the homocysteine, and then you might do further tests looking at your MTHFR, and you might find that you're missing a couple of the genes that help metabolize the folic acid.
Yeah, so good to get that looked into, because again, that's a simple thing that I've fixed with a number of patients, I have to say, and they've gone on to pregnancies. So if we see homocysteine, it is linked to folate metabolism. If you are getting a folate blood test, that isn't an accurate indication of how well you're actually metabolizing into your cells. It's just a marker of how much is in your bloodstream. So getting that extra test, like going to see Lynn nice and early, so you can get some of those simple things fixed up. We can get that homocysteine down. I know, but you are like to see it probably between a 6 and an 8, ideally, to show you getting a good folate, because we can't sustain a pregnancy without folate. We need it for DNA development, and it is. And why you need a prenatal supplement. I had a few people say to me as well, but my grandma, she had 6 kids and she never took anything. The hard part is folate is a really unstable nutrient. So you heat it, you process it, you cook it, you lose it. So if you're eating a lot of processed foods, if you're not getting your fresh seasonal produce as well. I had asparagus the other day that came from Mexico. You know, there's going to be very little folate left in some of our foods. So that's why a supplement is your insurance policy, to make sure you're getting enough each day. And we do need it daily. Folate's not maintained in the body. We need it daily. So yeah, good point.
Yeah. So definitely, and as you said, it's not, you know, unless you're eating raw greens every day, then you're probably not getting enough folic acid. And it's very important for the spinal cord development and the neural tube development and the brain development of the baby. Someone's asked just then, Tasha, what's the difference between CoQ10 and Ubiquinone?
Oh. Yes, we had this question we discussed the other day, and I've had that quite a lot recently. And I think because Ubiquinol is getting quite a name for itself in its own right, but Ubiquinol is a form of coenzyme Q10. So it's not an either or situation. It's just a really well absorbed. Coenzyme Q10 as a molecule is either in Ubiquinol or Ubiquinone. And the ubiquinone molecule isn't particularly well absorbed into the bloodstream. The ubiquinol is a better absorbed form of coenzyme Q10. And we know how important coenzyme Q10 is for mitochondrial energy, which, you know, the egg has more mitochondria than any other cell in the body. It needs a lot of fuel and energy. We produce a lot more coenzyme Q10 naturally in our first 20 years than we do in our from then on. So replenishing those stores. Yeah. And I know you recommend that to your patients.
All my patients are on it. And someone's asked, can you take both? You can take both. And that's what my patients take a mixture. So they'll do the 300 coenzyme Q10 and then they'll do ubiquinol on top of that. So yeah, usually I do give a mixture. I read melatonin can harm natural conception. Is that correct? Not that I've read. Have you seen anything?
I haven't seen anything harming being a problem for natural conception. I mean, it's not for everybody, but it is a great antioxidant in general. And again, we produce less as we age. Yeah. I also like to create it naturally as well. So working on the sleep-wake cycle, creating a nice healthy routine for sleep, similarly to what we were saying about the stress and transfer. The only time our body gets to focus on egg quality really is overnight. So releasing that melatonin overnight is so important. So I have an evening fertility ritual that I get my patients to do to put your body in a great space for that healing and repair overnight. So yeah, melatonin is an excellent antioxidant in general, and we produce less as we age.
Exactly, and we produce it naturally when we're sleeping. So I find a lot of night shift workers really should be taking their melatonin during the day. So when they come home from work, they should pop a melatonin tablet before they go to sleep to help, because you don't produce it as much if you sleep during the day.
Yeah, it is at that night time. So I get people to work in line with the day night if you can. If you can't, get some other support around that darkness. I've got high estrogen. How can I bring it down? Will anything help in the management of endo?
Well, we can suppress it medically, but exercise is a good way of suppressing your estrogen. So really exercising, and that has been shown to improve symptoms of endometriosis as well. And making sure you're in that ideal body weight as well, reducing your BMI will help endometriosis symptoms as well, and help lower your estrogen, because your fat cells produce estrone, which is another form of estrogen, which help feeds the endometriosis. So being your ideal weight will reduce your estrogen production as well.
Yeah, so healthy weight, healthy diet, it comes back to those things. The brassica family is quite good for detoxing estrogen, so you make sure you're clearing your estrogen really well. There's supplements around that, but literally just getting some great broccolis and greens and things like that can be really great for that estrogen metabolism. And getting some support around the endometriosis, there's turmeric is excellent. It's been shown to not only reduce the inflammation and the pain, but also help with the endometrial lesions themselves. So getting laparoscopy first, getting it cleared up. I've just sent a patient to you this week, Lynn, actually, who has had painful periods for her whole life, as long as she can remember. Her AMH is unfortunately 4 and she's 31, and she's never been looked at for endometriosis. Now, I'm not sure, but those sort of classic symptoms, get it get a workup with Lynn. That's why I'd go in to see someone early.
Yeah.
And then once you've had that, we can then support that maintenance and help keep that inflammation under control.
Yeah, get a diagnosis, because endometriosis is, when we look at all the areas of infertility, and endometriosis is one of the most common causes, and it causes inflammation. So even though it might not have blocked the tubes, its presence just sitting in the pelvis lowers your chance of getting pregnant. And studies have shown that if we clean up endometriosis, even if it's not in the tubes or the ovaries, it can actually improve your natural fertility, because it is an inflammatory disease where it's caused a lot of inflammation, and it can cause lack of implantation of the embryo because of the inflammation it's causing.
Yeah, and any inflammatory process we want to minimize, because we want to optimize that environment in which those beautiful eggs are developing. So minimizing that inflammatory process, as you said, even if it's not a blockage as such. Yeah, we just got a good diet assist with very low egg reserve. Yeah, nothing's going to increase your egg reserve, but yeah, it's the quality.
It will help the eggs that you've got left, so definitely. So it's not going to improve your egg reserve. But I've had patients that have done an egg reserve test at some point, and then 3 months later they do it again, and it pops up again. And so there is some variation in the anti-Müllerian test. So if you do get a low result, just check all the other things that you may be taking. So if you're on the pill, your egg reserve will come back low, usually. Even a Mirena IUD might affect the results. Pregnancy will affect the results. Breastfeeding will affect the results. And sometimes I think stress might affect the results. So important not to base it on one test. And also it's not the complete egg reserve test. You need to have an ultrasound to check your antral follicle count, and you should do a day 2 FSH, LH and estradiol level to get really the full package of what your egg timer test looks like.
Yeah. And increasing the quality of those eggs is the main thing. I've had patients that I've worked with patients of yours, improving the egg quality, and their collections have been quite small. You know, some only 2 follicles, yet they've gone on to, you know, I'm now seeing them towards the end of their pregnancies now. So it's about getting that quality. So even if we naturally have a lower AMH and egg reserve as we get older, and it's not about quantity, it's about getting that quality. So yes, lots we can do to get a good pregnancy outcome, even with a low egg bank, because we now know it's not just the fact that we have old eggs as we get older, it's the fact that those follicles are developing in an older body. So if we can improve that environment, we can get those better quality eggs.
It's very important. And we do see that in the lab. We actually see that even though some patients are getting low numbers, their quality seems to be improving with the supplements that we give them, Tasha. So whatever, you know, even the scientists say, you know, you can see from cycle 1 to say maybe cycle 2, which they've left a little bit of a gap, their embryos are improving and their quality is improving.
Yeah, I had a patient come back to me. She was so excited because the embryologist has gone into detail. She's very much a detailed person about the spindles and explaining, and she could visibly see the quality of her eggs from 3 months ago till now had visibly improved under that microscope. We've gone on to a pregnancy. We didn't get a pregnancy that round, but subsequent round she got a pregnancy. But she was so excited that she could visibly see the work she's done. And that's, I guess, the hard part I find to stay motivated. Some of the changes that we do get you to make are not just popping a pill. You know, as we said, exercise, diet, lifestyle. These things are happening. I think I saw a quote the other day that's, you know, just about stillness and about the pond, and it looks like there's nothing happening, but so much life is happening underneath. And that's the way I think about it when we are making those positive changes and we can't necessarily see our eggs. I wish we could go in there and see them improving, but you can see it in the positive. As I said, the embryologist looking at those eggs and seeing the improved results.
Someone's asked, how long after a baby can I try for an egg collection again? So I actually saw a patient last week who had a cesarean section, and she's a bit older, and her doctor, it was a difficult cesarean section. I think she had placenta previa where the placenta was low down, and her doctors advised that she shouldn't get pregnant for another 6 months. But we've actually decided we're going to start collecting eggs and storing her embryos so that in 6 months' time, when she's going to be in her 40s. We've got some embryos sitting there ready to go for her second baby. So we really, there's no sort of right, there's no time that you have to wait after a baby. We do worry a little bit about breastfeeding and the IVF medication, but there's no time that you have to wait and have a baby unless you've had a cesarean section. So if you've had a normal delivery, there's no time in between the pregnancies that you do have to wait.
Yeah, so I think it's such an individual thing. It's when you're ready, and also obviously you do all the lovely prenatal checks that you're talking about. Get your levels healthy, look at your vitamin D, your iron, your thyroid, make sure everything is healthy after that pregnancy, and that you're in a great place going forward to get those healthy eggs. I just had a question about men's vitamins there, sperm health. I guess we haven't touched on sperm health too much, but I know you have a fertility formula for men, a few you recommend, and I can chime in there as well. But what do you recommend, Lynn?
Well, getting the guys to sort of eat healthy if possible. So a lot of guys have very bad diets. So looking at their diet first, and then a lot of guys are still smoking cigarettes. So stopping them from smoking, excessive alcohol. So looking at all their lifestyle changes, and trying to get them to stop buying takeaway at lunchtime, going to work with a salad or something. And then looking then at supplements. So we do have a supplement pack, and zinc is in it. We have folic acid, fish oil, coenzyme, vitamin D. So we have, we try and supplement the guys with vitamins as well to get their sperm as healthy as possible.
Yeah, and there's lots we can do with sperm health. I like him, and I have a few women come to me. It's just me. He can get me pregnant. It's me. It's all about me. I can't stay pregnant, and I really like to let the women know it's not just about him getting you pregnant. Sperm health is involved in the health of the embryo, so that's involved in miscarriage as well. It's involved in the health of the baby, and we now know. I did a podcast with Associate Professor Adam Watkins about how it actually improves the lifelong health of the future baby. So it's really important for him to get healthy. And as we discussed last time, Lynn, I think, I know I shouldn't, it's sort of a male-female thing. As women, we start with 100 follicles and we refine and we refine and we produce that perfect egg that we spit out ready for ovulation. Whereas men have the total opposite approach. They throw millions at it, and look, in a good selection, 80% of those are not great quality. So more what we probably see, and you probably see, 96, 95% of those are not great quality. So we can always improve sperm health. So yeah, looking at your vitamins, diet, lifestyle.
Yeah, and it's amazing the parameters for sperm health have changed over the years. So, 10 years ago we used to accept 85% abnormal, but now it's changed up to 96%. And that is a lot of abnormal sperm, 96%. And so, and we're seeing more and more abnormal forms. And that's probably lifestyle, I would say. And again, pesticides in our foods and plastics. And so there are lots of studies linking poor sperm quality with pesticides and plastics. So I think also watching your surroundings, trying to limit your exposure to plastics. And as you said, Tasha, in some of our other talks, even the eating tinned food lined with, BPA can affect sperm and egg quality. So very important to try and limit intake of plastics and pesticides and BPA.
Yes, avoiding those toxins, which unfortunately we are exposed to, all of us. It's pretty much ubiquitous, but minimizing your exposure as much as possible, because the BPAs are found in seminal fluid, in follicular fluid. They're found bathing around our eggs. The good news is they're generally out of our system within a couple of weeks. It's just that constant exposure that is the problem. So yeah, canned foods is one that I think a lot of people realize. It's BPA lined cans, but of course your drink bottles, opt for glass or stainless steel, because the BPA free plastics have been replaced with BPS. We don't know what that necessarily does, so avoiding plastics altogether. And BPA is a plasticizer, so it makes the plastic supple. So if you think an ice cream container that snaps versus a squeezy drink bottle, which is going to have more BPA. Also freezing your food in BPA leaches it more. Same with heating. Most people know heating, freezing it as well. So freezing your leftovers in takeaway containers and things like that. Just minimizing exposure to all those toxins. Smoking, of course. But yeah, keeping your man really healthy. And deodorants and phthalates is the other thing. I get a lot of men spraying all those deodorants and things like that. Minimizing fragrances. That's why in your lovely labs it's all pristine. There's no fragrances in there because they're endocrine disruptors. So
yeah, we don't allow anyone. Well, we asked you on your transfer day, and that's something I didn't mention when we were talking about transfer, not to wear perfumes or any deodorants that have any odor. Very important to keep clear of the lab if you are wearing perfume. So we don't let anyone in the lab or the lab area with perfumes on because they affect the embryo development. So we're very, very strict about perfumes, deodorants, alcohol, hand wash actually. We don't let any of our staff use that in our lab area as well.
Yes, I've just heard someone say so many things, and yes, there is so many things and it can be overwhelming. So that's why I do recommend going to see Lynn, getting a workup, speaking with someone like myself who can tailor your needs and work out what is going to be most important for you. Because yes, there are lots and lots of things. There are lots and lots of supplements you can take. And I do have some people come to me on all of them, but yet some fundamental things are lacking, like they still have high homocysteine, they're taking the wrong form of folate, or they're overweight but yet they're taking a lot of supplements. And make sure you're getting those fundamentals right, and speak with someone. Go and get your checkup with Lynn, get all your preconception checks done. I love working with your patients because they have had such a thorough workup, and I love seeing the bloods. They say the eyes are the window to the soul, but I love blood tests. It's the best marker we have of seeing what's going on inside, plus all your questioning as well.
And weight for men as well is very important because we know that weight overheats the testicles, and then overheating the testicles decreases the sperm production, decreases the motility, increases the abnormal form formation, and increases DNA fragmentation. So someone's just asked there, how can I improve DNA fragmentation? And one of them would be weight loss. That would be a really big thing. And then getting on high dose antioxidants. And we didn't mention before lycopene. And we know lycopene is a great antioxidant, particularly for sperm health. And as Tasha, you've said before, lycopene's released when you cook the tomatoes. So it's better to cook your tomatoes and eat them cooked, or even in tomato sauces. They're very rich in lycopene as well.
Yes, I think your Nonna's old tomato sauce, and the Italians knew what they were doing. That's why I think the Mediterranean diet is so great. But most nutrients, or a lot of them, are very temperature stable. Like folate, you heat it, you lose it, whereas lycopene's quite the opposite. So that's great in all those tomato sauces. Lipoic acid is great for DNA fragmentation as well as egg quality. It helps to protect that developing DNA. And simple things like vitamin C, eliminating toxins, because eliminating our exposure to these things, antioxidants are great, but if we're constantly re-exposing ourselves to these triggers, and I look a lot at that partner's job as well. What is he doing? Is he a painter? Is he an electrician? Is he a carpenter? What is he exposed to at work? What can we do to minimize his exposure? As well as helping with some supplements. Sometimes he might need more liver support. He might need to do a bit of a detox to help him improve his sperm quality, depending on what his job and his exposure has been like.
And also some men have what we call varicoceles, so that increases your DNA fragmentation. So if you do have an abnormal sperm test, then it's important to go and get an ultrasound of the testicles. And I know guys hate it, but I really think that they should go and get a testicular ultrasound. And over the years, I've actually picked up about 3 or 4 cancers that wouldn't have been picked up unless they had that ultrasound. So if your sperm parameters are coming up abnormal, get a testicular ultrasound. Just check the testicles out, and also rule out varicoceles, which can cause DNA fragmentation.
Yes, so they're very important. I mean, you can get surgery, but there's a lot we can do naturally as well to support the varicoceles if you do have them. Lots you can do to support DNA fragmentation. So there's a question there, yes, can you improve it? Yes, you can. You can help to improve, and particularly sperm's probably easier in some ways to improve than the egg quality, because there's a whole new batch of sperm being produced every 90 days. So if we can optimize that environment, we can get him off cigarettes if that's the case, less takeaways at the, you know, shop in the morning, the sausage rolls and the typical tradie diet that I have a few husbands on. So those sorts of things can make a massive difference, and get some support around that and some structure, because I don't expect him to eat lettuce leaves and go from sausage rolls to lettuce leaves, but there are things we can do to improve his diet.
And it's really good when a patient hasn't got great embryos. I usually get the patient to have an appointment with our scientists, and the scientists will get out their embryos and look at them under the EmbryoScope Plus videos that we keep on every embryo. And they'll be able to tell the patients where things went wrong. And they can actually look at the embryo and say, okay, this embryo is suffering or not getting to day 5 or not getting to a good day 5 embryo because it's a sperm problem. And so this is the sort of information we can give back to patients because we've got the EmbryoScope Plus. So we can give so much more information back to the patients because of the time-lapse machine that's constantly taking images of your embryo. So we can see where things did it go wrong at fertilization. Did the pronuclei develop properly? Did the polar body come out of the egg properly? So many things we're seeing with the EmbryoScope Plus, which is helping us give answers to the patients as well.
I love that. I just got a patient who got her report back just the other day and sent it through, and it's wonderful. I can see, okay, we can see what's happened. We can see where it's gone wrong. And I think that's the hardest part for a lot of this is the lack of information or uncertainty around your next best steps, but knowing what went wrong and taking proactive steps to improve it for next time is so empowering and can create much better outcomes. So yeah, the information is key, and I love the way you do give that extra support to your patients around that.
Yeah, I think it's very important to speak to the scientists and get their perspective. And sometimes I'll have the scientists in our appointments with us so they can actually give a perspective of what was going on in the lab with that embryo. And I love having the scientists in with the appointment. I think the patients love it as well. So I get a lot of feedback about was it a sperm problem? Was it an egg problem? Was it a combined problem? And then they know what to work with.
Yeah, it's amazing. The embryologist is so fascinating, I have to say. And someone said, how do you know if you're taking too many vitamins? And that can be the case. And I do, again, get some support around this, get your levels checked, get someone who knows what you should be taking, because yes, you can take too much. I see a lot of women taking some, you know, quite well-known supplements that are really high in iron, and they're getting constipated, they're getting black stool. That's not good. Iron should not be constipating you. If it's getting into your bloodstream and being used and metabolized, then it can't be constipating you. There's nothing left to be constipating you. So if you are taking too much of some of these, I said particularly iron, I see a lot of women who think, iron, I need to get pregnant, I need lots of iron. Not necessarily. So just getting your levels checked, getting the right dose and the right form of iron for you. There are some supplements, the vitamin C, less important. Your guts will tell you when you've taken too much, you'll just get rid of it. But there are others like zinc, like iron. Zinc I do find really important, so I'm always cautious. Most people actually do need more zinc, but iron probably particularly, I find that they're often taking the wrong form and the wrong dose. So get some support around what vitamins are right for you. They aren't just something you can take willy-nilly. It does make a big difference in getting them right. Obviously, taking a good prenatal is a good start, which is a good all-rounder with your folic, folinic, and your choline, which we didn't touch on. So look for a prenatal that provides choline, which has been shown to work alongside folate in the development of the neural tube. The American Medical Association have now said that choline should be in all prenatals. So do look for that. So good prenatal, but on top of that, ask Lynn, get some support around which ones are right for you.
And eggs are high in choline as well, so try and eat an egg a day as well. That's going to support your choline as well. And someone asked before about 2 embryo transfers. Should I look at doing 2 embryos during my transfer? We tend to advise against doing a double embryo transfer now. Now, as the technology's improved to where it is, there's no need to put 2 embryos back. And in fact, you might be wasting one of the embryos. So you could have an amazing embryo and then maybe not so much of an amazing embryo, and you put them both in together, and the not so great embryo will signal to the lining, and they signal to each other before they implant. And so the lining could switch off because it realizes, well, there's an embryo there that's not so great. But the lining might not recognize the embryo that's really great, and all of a sudden all the signals change and it stops that really great embryo implanting. So we only do one embryo at a time at our clinic, and we're quite passionate about that. And we want to send you home with one baby at a time, a healthy baby. We don't want to send you home with twins that might deliver early and have complications. So one healthy baby is what we're aiming for our patients.
Interesting about the lining there. I think, yeah, you think more is better, but not necessarily. Same as what we said with vitamins, more is not necessarily better. I just had a question there. What do you recommend on taking folinic acid on top of your prenatal? I have to say in Zycia, I've got folinic and folic acid in there. I do recommend feeding that that folate pathway at a few different places. So getting your folic acid, getting your folinic acid, and getting your dietary sources, which I've said, it's hard to get them because they're easily lost, but getting lots of green leafies. So taking a good prenatal with folic acid and folinic acid, because the folate pathway is actually quite cyclical. I actually show it quite a linear pathway, but it's quite cyclical. So we can feed it a few different places. We can optimize the folate that's getting into your bloodstream. So yeah, folic and folinic, and lots of food sources, lots of leafy greens. Do what your nan said and eat your greens.
And someone asked a question, what about PQQ, which is a supplement to try and boost your mitochondria? I don't think that can hurt. It's just how many supplements do you take, like what we said before. I know my recommendation, I think there's 7 or 8 on the recommendation list, and then you just add another one. So I don't think it's going to do more than a coenzyme Q10 will do.
Yep, I do. A lot of people are on a lot of supplements, so do make sure you get it tailored to what you need. There are some, obviously, your prenatal, even things like vitamin C, are probably pretty innocuous, and everyone can take those, but do get a tailored recommendations on some of those other. There are lots. We won't run through them all now, but there are lots. You've probably Googled them yourself, but they're not always good for everyone, so make sure they're right for you. I did have a question about fish oil before.
That's right.
Yeah, so fish oil is I think I mentioned about, it's an essential fatty acids involved in every single cell in the body. So yes, and there is research around it improving older eggs as well. So I do a good quality fish oil, and I know you recommend a good quality one as well. I go for the ultra clean, or I use Metagenics, or something that's really high quality, because you don't want heavy metals. And I know there are a lot on the market that you're allowed to claim heavy metal free under a certain level of heavy metals, because that's considered safe. I don't think any level is safe, so make sure you're getting an ultra clean pure fish oil. And also for sperm health, the sperm head is very rich in DHA, so that's particularly good for sperm morphology as well.
And I think it's important to remember not to buy cheap fish oil, because some of the, if you think about how that fish oil got to the pharmacy, it could have been sitting in the back of a truck in a clear bottle, overheating in the sun, and then by the time it gets to the pharmacy, it might actually be rancid. So I think it's very important to, don't go for the cheap fish oil, because I know you can buy them in big tubs.
Yeah, big dump bin.
Yeah, I think it's important not to get the cheap version of fish oil. I think that's probably more harmful than taking it at all. So, yeah.
I agree. And it shouldn't have that fishy, rancid aftertaste. So some of your containers you can even smell that fishy odor. It shouldn't smell fishy like that. Your fish oil capsules shouldn't smell fishy. They shouldn't even really taste fishy. So if they do, then get a good quality. You are getting what you're paying for to a certain extent of your fish oil. So
yeah. And so someone's asked, what sort of fish oil should they purchase?
I use Metagenics a lot with my patients. I do use Biomedical one that's particularly high in DHA if I'm using it for sperm health, because most are higher in EPA than they are in DHA. So that one is particularly, the omega E's is particularly rich in DHA. So they are practitioner products, and they are practitioner quality products. So see your naturopath, see someone like myself who can prescribe some of these. They're higher dose as well, so they're really rich in the active ingredients, and they're very pure. So yeah, Metagenics Bioceuticals is one you can maybe get at your pharmacy. Ethical Nutrients is probably a good over-the-counter brand you could find, but yeah, go for the unfortunately more expensive variety.
And someone's asked, do you continue fish oil? Definitely continue fish oil. Even right through the pregnancy, we would recommend you continue the fish oil, because it's important for the baby's brain development.
It is. So right through, and good for prenatal care afterwards for breastfeeding. So fish oil is something that you can quite safely stay on throughout your pregnancy. There are a number of supplements that I do recommend throughout. So yeah, fish oils, probiotics, we've spoken about before, and get them tailored to what you need. They're great for reducing inflammation. So anyone with irritable bowel or inflammatory processes like that, getting that under control can be as simple as that to help create that nice environment. So if you are getting bloating and diarrhea, constipation, you may not associate that with egg quality, but that is an inflammatory environment that your eggs are developing in. So if we can get those under control, and I often get asked, which probiotic should I take? And that's one I find harder to answer unless I know your unique situation, because that can be quite a tailored approach.
And so for pregnancy, you need your good pregnancy vitamin, your fish oil, and your probiotic. Because someone asked before, because do they stop all their supplements? And most of the supplements, once you're pregnant, most of the supplements for egg health and sperm, well, supplements for sperm health you can keep going, but for egg health, you don't need them once you're pregnant. So, but you know, good pregnancy vitamin like your one, Tasha, fish oil or omega-3, and vitamin D. Make sure your vitamin D levels are good. Iodine, if you make sure your pregnancy vitamin has iodine in it. It's good for baby's brain development as well. So, and a good probiotic. I think they're the main things that you should be taking when you're pregnant.
Yeah, they're the ones I often continue all the way through. And I say, how long should I be on, I guess, these supplements and do these changes before doing IVF? And I guess that's what we're talking about today, is the 90 days, the precious 90 days. And that is the ultimate, the ideal is from when that tiny primordial follicle is developing into a mature egg, that whole 90 days does influence the development. It's never too late and never too early, though, is what I say, to make positive changes. But ultimately, if you can make the changes 3 months prior and be on some of these supplements and dietary changes 3 months prior, you're giving yourself the best chance of creating that healthy egg and sperm.
And then a healthy baby as well. So lifestyle changes will help create, and it sort of sets in motion how healthy your pregnancy is going to be. The placental formation, we know sperm health affects how this placenta is going to form, and that placenta is going to feed your baby for the next 9 months. So we want a really good placenta, a very healthy placenta to feed your baby right up until it's delivered.
Yeah, I often say to my patients, you wouldn't go out and run a marathon tomorrow. I mean, you probably wouldn't survive anyway. I know how tough it is for me to run 10Ks, but we don't, you know, not that pregnancy is a marathon, but it is something that's going to drain a lot of nutrients and need a lot of reserves. You really need to be in a great space. And the better you are health-wise, you are optimizing the DNA you're passing on to your future child. You are never going to get that opportunity again. So I believe that the best investment you can make in your future child's health, you know, forget the $50,000 school fees, is right now. If you haven't conceived, it's right now that you can influence that egg and that sperm health, which with studies show improves not only your chances of conceiving, but the lifelong health of your future child. So do the work, get yourself, both of you, in the best health possible, for the sake of your future baby. Your future baby will thank you for the investment you're making now in their future health.
Definitely. And it will make my job easier to get you pregnant as well. So, and that's what we want.
I love that, Lynn. I love that. That's what you're passionate about, getting people pregnant. It's not just about IVF, another person in the door. You're passionate about getting them pregnant and doing the investigations and really understanding what it is for them and helping everyone achieve a healthy pregnancy outcome. Yeah. So I think we're probably coming to the end of our time here. Look, there's a few questions that probably popped through. I know we were trying to track them, but if you wanted, you know, DM myself or probably Lynn, just let us know if you got any questions. We're more than happy to answer them.
Yeah,
so anything you'd like to leave us with, Lynn?
Well, I think that, you know, like we said, 90 days is really important, but, you know, if it's not 90 days, 180 days, every day is very important. And we know the fertility journey can be long and it can be very windy. It may not be a straight road for you. And the trying to get yourself in the best health during fertility treatment is an absolute key. Because if I can work with healthy eggs and healthy sperm and give you a healthy embryo, I'm more likely to get you pregnant very quickly, hopefully.
Yeah. Excellent. Well, I love that advice. So if you've got any further questions for us, do let us know. But I hope that's been really helpful. And I look forward to it. If it is, let us know. We also love hearing pregnancy news. So please DM us with that as well. It's always wonderful. So thank you very much for joining
us. Thanks,
us.
Tasha.
Look forward to seeing you soon.
Bye everyone. Bye.